Let's go to number 8. Take a hot bath. That's what I always do when I'm upset. It hurts. Natalie's on the fence.
Yeah, it's irrelevant.
You say it's relevant?
No, it's irrelevant.
It's irrelevant.
Yeah.
Okay. What are you thinking, Natalie?
Well, I guess it's kind of diminishing the issue too. Because if it's 2 weeks or more and you're feeling down, that's serious. And I don't know if a bath is really gonna. I love hot baths too, and a glass of wine, but that doesn't mean this person
That's right.
is really, that's gonna help them.
That's right. I love that. And so just like we talked about earlier, depression looks different in everybody, right? And so again, seeking the professional support, because that in and of itself is a coping tool, right? So setting the mood in your home when you're feeling sad, creating that sanctuary. There are certain oils that you can use that are actually beneficial to increasing where you're not feeling depressed, giving you more of a relaxed state. Lavender, tea tree oils, oranges, different smells like that really help to reduce those symptoms. So again, you want to just refer them instead of taking it on yourself of what you think would be common. You want to refer them to somebody professional. Number 9, I listened to you talk about it, and I can't imagine what it's like for you. I just can't imagine how hard it must be.
Helpful?
Yeah, they're trying to relate.
Okay.
Yeah.
I don't know.
I'm not sure it's helpful at all. I think it's kind of again both.
You think it's both again?
It could be helpful, but it could.
Okay.
Or not.
What do you think?
Standalone, it's hurtful, but if it has more advice on the backside, seeking right places,
It could be helpful.
it acknowledges that you're listening and that you're,
Okay. Okay.
They're trying to relate.
So they're trying to relate. So depending upon the backdrop of the conversation.
Right.
But just this word by itself, do you think it could be helpful or no?
No.
No. Okay. What you need is some real tragedy in your life.
Yeah.
That sounds like my grandma.
Okay. You say no. Hopefully everybody is saying no. This would not be helpful.
It's not comedic, but it is. For that to be up there.
Yes.
But people say that.
But here's the thing: more common and more often than not, people do say that, like you said. Your grandmother would say that. So depending
Like you
upon
have to live longer. You'll really
Yes.
know what it
Yeah,
is.
yeah. Be grateful.
be grateful.
Not like a malicious
Yeah.
place, not coming from a malicious place, but that's kind of like the old school way of addressing things.
Yes.
Like you're too young to have problems.
Yeah. So how do we then create that to where we can have the conversation? So you're talking to your grandparents and they just don't understand. They're still telling you things like that. So how would you then explain to them what might be the conversation around that to help have a healthy conversation about mental illness?
I'm gonna talk to somebody else, Grandma.
You don't know? No thoughts about
I
how
don't
you...
think family and friends is who you should be talking to anyway when you get to this point. You might want to mention it to somebody just to get their opinion, but I think in the back of your mind, you have to say, I think you need to talk to a stranger. You need to talk to like someone like yourself.
So you don't feel
Because
judged.
you need someone that has an unbiased opinion,
Ah.
right?
I love that.
That's a good point.
Yeah. Yeah, and here's the thing, as family and friends, we're gonna do our best to support you and wrap our arms around you,
Right.
but everything
fix
that
it.
you say
You wanna
is not
fix it.
going to be helpful,
Yeah.
right? So that's why we're putting these funny antidotes up here. Let's see, I just wanted to point out, where are we on time?
Like 14 minutes.
Yeah.
Okay, so on page 12, it talks about making an action plan. So all the things that we've mentioned here today, and I want you to also, after this training, make sure that you go to the end of those pages where it outlines the differences with clinical depression. There's something that talks about bipolar disorder. And so you want to be familiar with those terms and what that looks like. But right now, in making an action plan, what ideas, behaviors, attitudes, feelings, and techniques about how to support mental health concerns in the workplace did I gain from this training? You want to list them below. Who will you check in with to make sure you are making progress? So again, this is about being aware, right? So hopefully throughout the exercise that we did, for some that you thought, yeah, well, I think that would have been okay to say, and it turned out that maybe it's not as helpful. What did you gain from that? And then when something comes up, when you recognize now the symptoms of somebody that was maybe more motivated and now they're sort of isolating, they're withdrawing, they're not as energetic as they were before, what are you going to take away from this training that can be helpful to them? And we can talk about that. So what are your ideas?
Well, I mean, one of the things you could do is say, hey, I went to this training course, and I mean, maybe we should have some kind of cards or something to pass out and say, hey, this is the EAP phone number, and,
Yes.
and you know, just so immediately offer them
Yes, I love
something that
that.
they can
Something
put their
tangible.
hands on, tangible.
Yeah, so Optum with the EAP program, we provide 3 to 5 sessions per issue per calendar year. Okay, and that's available free to you and your immediate family member. Okay, so often it's free, so you've already paid for it. It's something that the company, I guess, pays for you. So you want to make sure that you take advantage of that. And I have a lot of clients that come in that utilize their EAP benefits. There's nothing wrong with that. And for people that are a little bit squeamish about the therapy process and what it looks like, this is a great opportunity just to see, you know, without putting any money in it just yet, what will this be like, right? And so again, EAP is short-term therapy. It's not meant for you to go long. So if you have some deep-rooted issues, again, EAP is just going to talk about those things that are currently going on with you and how we can get you back to functioning. So 3 to 5 sessions per issue per calendar year. So just 3? Okay. Wow. Well, see, so let me just say this. You have 3, but there are, you should be able to do an extension. I know for some that I've used for Optum, I was able to extend it based upon how that person was progressing. So, yeah, but it's 3 to 5 per issue per year. So
that's good to know.
you don't have to just come in on just one. I'm feeling depressed, and you do your 3.
Yeah.
Then you can come back and say, okay, now let's address my daughter who's giving me heck at home.
And that's the face-to-face counseling. If you want to call and
They
talk with
also
somebody
offer-
on the phone,
Mhm.
it's unlimited.
Yeah.
Oh, wow.
Yeah, and also let me just say this, what I found that's new is virtual. So some plans through your insurance in terms of EAP will allow you to do the virtual, so that you don't have to worry about driving to somebody's office, which then saves on time. You're in the comfort of your own office, home, car, whatever it is that you're wanting to utilize. So again, I just wanted to bring that to everybody's attention. How are we, because it's one thing, we can talk all day about ideas and solutions, but how then are we going to take this and apply it to when we see people that are hurting? Okay, not feeling ashamed, knowing that you're not weak if you are dealing with an issue, and that there are things in place, people that you can reach out to who are willing to help you. Okay?
I have a few comments. if
Yes.
you're ready. Okay. This was around the conversation we had earlier. I believe it's by Fabiola. She says to have a healthy conversation takes 2. And sometimes it's okay to say, please, I just want a listening ear. I think that might have been a response to how do you approach your grandma or family member if they're coming at you in that negative way. And she's
Yes.
saying, you can just say, I just want you to listen. Can you please listen?
Yes.
To me? I thought that was a good comment.
It's a wonderful comment, because we are in the business, especially women, grandmas, we want to fix it. We're nurturers. So, oftentimes we're in this habit, and I think that just goes into communication. We're listening to respond and not to actually hear what the person is saying. So, are you listening to what I just said, or are you just trying to make me feel better because of your own stuff? I don't want to get into that. That's too deep. It's okay. You just keep on pushing.
Yep.
Right.
Yep.
So I love that. That's a wonderful point.
Another question is, does the EAP have counselors that speak other languages? Not
Absolutely.
Spanish, Portuguese?
Absolutely.
That's great to know.
Absolutely.
Because we do have some people from our Latin American
Yes.
business as well on here.
Yes. Absolutely.
the EAP phone number. I'll send it out in a follow-up email after this, along with the material.
Okay,
And I think that's my point exactly going back, is I think that the company should go ahead and be proactive. I mean, I know we've had those little journey cards, they're red or something, like if you're traveling, I know Rudy, as much as you travel, you probably have one. But, but I mean, just to go ahead and make something that's, you know, double-sided in a business card, and just go ahead and pass them out to everybody. Let the company just get on top of it and be proactive.
yeah,
Instead of waiting till somebody comes in, or you think someone's depressed and you approach that person and say, oh, hey, by the way, you need this EAP card.
yeah, yeah,
So
I
just
love
put on
that,
top
so,
of that and just
so
do
maybe even, integrate or putting that into an orientation piece for new employees to
Absolutely.
have, yeah.
Outside of trainings, does the company encourage their employees to seek out help? Because you can go to a training one day and feel good, and then 2 weeks later you're in the middle of work and you may not have a training, and you may forget about it and may go through some things.
Does the company encourage us to be able to attend things like this?
Well, encourage to have the conversations or to seek out EAP.
I think they do, especially
Yeah,
our
I mean,
people group.
Yeah, we try to advertise it as much as possible.
Yeah.
But I do think it's
Yeah.
up to the leaders to help disseminate the message, and
Yeah.
especially, like you were saying, you talked about the supervisory tasks, and I thought that page in the book is gonna be really helpful
Yes.
to look at. I think we are the key to helping, that message permeate and to make it actually living and breathing.
That and the identification
Yes,
of, you know, making sure that all of the people around us
Mhm.
are.
because we have so
Okay.
many programs, right, and it's really hard, it's easy to see it as white noise and
Yeah.
to not really pick out what's important or what's
Mhm.
relevant. And I think it's really up to our supervisors, our leaders, to be keen on that,
Yeah.
recognize things, and then push people to the right resources and areas.
Sure, so again, integrating all of what you're saying, because oftentimes what I see the disconnect is that specific departments work in silos, so one doesn't know, they're not speaking to the other in terms of interacting and knowing who it is that they're working with. So if I'm not talking to you, I mean, you're just sitting over here, my back is to you all like this, you know, for me getting that out, then how would I recognize that you're coming in and you're having some behavioral things, right? So, you know, just to continue to have that conversation, I love, Ms. Patty, that you brought up about continuing to have, like you said, the journey cards, maybe putting that in orientation, in your team meetings, having different topics in terms of that, and also just making it available for people to feel comfortable about having the conversation. So whatever that might look like for your specific company. Yeah.
Very good, yes. I just asked for a last questions, comments. Usama bin Musa, one of our project managers, directors, says often depression is intertwined with alcoholism and or drug use. You can't address depression without addressing addiction.
Okay, so tell me more about what you mean. You can't address depression without addressing addiction, because when somebody's depressed, there are many key issues into why they are depressed. So how they're responding to what's actually going on. Substance abuse is how they are responding to what is going
Not
on.
causal.
Not necessarily causing. Now, what I'm hearing this person say, or what I'm taking from it, is that oftentimes when we use substances, it does put it down, right? Just like there are substances you can use that makes you up. So, I'm not sure where Mr.
Usama bin Musa.
Ben Musa is going with that, but yes, if that is what you're doing, you're using substance abuse to funnel something that you're dealing with, and it's continuing to make you more depressed as opposed to pulling you out. The substances in the alcohol or whatever it is that you're using can keep you there, but it's a symptom of depression. It's not. So I just wanted to make sure that I'm not going in some direction that.
You can't treat or help someone unless they recognize they have a problem. Is his final comment, I guess.
That's true.
Yeah,
Yeah.
that's right.
Absolutely true.
That's right. You can't treat or help someone unless they recognize that they have a problem. So how do we continue to have the conversation again for somebody that doesn't see that they have a problem? How do we do that? That's really, really a sticky situation, right? and they're coming and they're having accidents and they're getting into arguments and they're being insubordinate and all of this stuff is going on, and you know that there's a deeper rooted issue. So what things do we have in place to address
I mean, I
that?
think it's just where the leader has to, or the manager, and if it's manager, then it's that manager's boss. It just has to come in and say, okay, we have to talk,
Yeah,
but not just to have the two of them, in the room, have somebody from EAP on, or something,
Fabiola says patience too.
okay, so having patience
Don't be
with the
patient for
person.
so long.
Right, so I hear what you're saying too, so there's a slippery slope there, because on one hand, as managers, as leads, as team workers, you have a responsibility, like you have your job, okay, and it's not to put out, well, sometimes it is to put out fires, depending upon where you're sitting, but you have a thing that you're responsible for doing when you go into work. So somebody that's coming in and dealing with these issues that we're talking about, whether you recognize that it's substance abuse or whatever, and you've had the conversations and they feel like it's nothing wrong with them, and you've offered the EAP and you've documented all of that, what else are you supposed to do at that point?
Gotta keep talking to them, you gotta elevate it and get other support.
That's right, so bringing in the other support, yeah.
So what's the breaking point? What's the bright line for we've done all we can? We need to refer you on to somebody outside of the company.
Isn't that the first step? I don't think that's the last resort. I think that's the first step.
So give an example of that, Miss Natalie. When you say,
If I have an employee, and we have like 1 minute, so if I have an employee that I'm noticing has performance issues, I guess it's now that I have some more information, maybe I can, with this training, I can now recognize and say, okay, this is unlike that person, so
Yeah.
maybe it really is something deeper.
yeah,
Asking them if something's going on. If they reveal something to me, then I say, okay, well, we have EAP for
Yes.
you. You know what I mean? That's my
Yes.
first
That's
thing.
the
That's
first
not
step.
my last resort,
Right.
actually.
right. So is that where you were talking about, the bright line?
Well, I mean, as far as the company, how much they can help. If the person refuses to use EAP, then what's the manager's next step?
Responsibility.
Yeah,
Well,
there's
and I'm sure that's what we're talking about, so having things in place, policy, procedure,
It's gotta be.
for it has to be
policy.
escalated
Yeah.
until those final steps. So we
Yeah.
know what the final steps are, but this is not to talk about people that, once they're dealing with their issues, that they're gonna be out the door. That's the most extreme case. We're talking about creating an environment where we can have the healthy conversation. So again, thank you so much for everybody that's tuned in. Miss Natalie is going to send out the EAP information for you through Optum. If you are looking to